Assalamualaikum and hi everyone. I know you guys are excited to learn about osteoporosis. But first, let's learn about metabolic bone disease. Metabolic bone diseases are diseases that cause various abnormalities and deformities of bone. The examples of metabolic bone diseases are osteoporosis, rickets, osteogenesis imperfecta, and Paget disease of bone. In clinical terms, metabolic bone diseases may result in bone pain and loss of height due to compression of vertebra, and they predispose patient to fractures. Metabolic bone diseases are disorders of bone strength usually caused by abnormalities of minerals such as calcium and phosphorus, vitamin D, and bone mass or bone structure. While bone loss does occur as the part of aging process, there are many diseases, medications, and conditions that can increase bone failure. When untreated, osteoporosis can lead to fragility fractures, bone deformities, and serious disability. Lastly, most metabolic bone diseases are extent to which they reduce bone density.
Okay, what is osteoporosis? For definition, osteoporosis or porous bone is disease characterized by increased porosity of the bone resulting from the reduced bone mass. Osteoporosis is a skeletal condition involving progressive bone loss and microstructural deterioration leading to increased bone fragility and susceptibility to fracture. It is the most prevalent metabolic bone disease among adults worldwide. The magnitude of this disease is immense. Okay, for pathological condition or osteoporosis pathogenesis, bone is continually being formed and resolved. We also can see osteoblasts and osteoclasts are regulated by parathyroid hormone, serotonin, estrogen, vitamin D, various cytokines, and local factors such as prostaglandin. It a peak bone mass in men and also occur in women by mid-20s. Osteoporosis occurs when bone loss exceeds bone formation and it resulting in low bone mass. Thus, this disease should be viewed in the context of failure of the remodeling cycle to replace all the resolved bones. Okay, next, for the categories of osteoporosis. There are two categories of osteoporosis has been identified. They are primary and secondary. Primary osteoporosis is the most common form of the disease and include post-tumoral osteoporosis for type 1 and age-related osteoporosis for type 2. Secondary osteoporosis is categorized as having clear defined etiologic mechanism.
Next, we move to the significant clinical signs. Usually, there are no symptoms in the early stage of bone loss, but once your bone have been weakened by osteoporosis, you might have significant clinical signs and symptoms that include loss of height over time, change in posture, stopping or bending forward, bone fractures, a bone that breaks much more easily than expected, pain in the lower back caused by a fracture or collapsed vertebra. Osteoporosis has many risk factors, so I will explain 5 factors that will increase the risk of developing osteoporosis. Sex or gender. Women more likely to develop osteoporosis than men. Age. The older you get, the greater your risk of osteoporosis. Family history. Having a parent or sibling with osteoporosis put you at a greater risk, especially if your mother or father fractured a hip. Excessive alcohol consumption. heavy drinking of alcohol can lead to thinning of the bone and make fractures more likely. Low calcium intake contribute to diminished bone density, early bone loss, and increased risk of fracture.
Next, there is a lot of diet and nutritional recommendation for osteoporosis disease. For example, calcium, vitamins, minerals, and protein. First, we look at calcium. Calcium plays an important role in maintaining the strength of our bone and teeth, as well as the functioning of our heart, nerve, and blood clotting. Ensuring you have enough calcium in your diet is an important factor for bone health. Foods that are known for containing calcium and form a part of osteoporosis diet plan are dairy products, green leafy vegetables, nuts, and fish with small edible bones. Next, vitamin D. These fat-soluble vitamins come from food and from our bodies when our skin is exposed to the UV rays from the sun. The UV rays from the sun trigger the production of vitamin D in our skin. This vitamin is important as it helps our body to absorb more calcium. Vitamin D can be found in a certain food including eggs, oily fish, and fortified breakfast cereals. While calcium and vitamin D are essential, they are not the only important nutrient for bone health. Zinc, boron, and manganese are also essential as they are like glue that hold a framework together. Phosphorus also important as it supports building bones and other tissue during growth. We also rely on vitamin K2 to transport the minerals into our bone. Vitamin K2 can also be found from green leafy vegetables. As you can see here, these are the material for diet and nutritional recommendation for osteoporosis. Therefore, eating a balanced diet that contains a variety of food is important when looking for bone health.
There are many ways and actions that we can take to prevent and to control osteoporosis. First of all, get the recommended daily amount of vitamin D and calcium. It's either from natural sources or any other supplement that are recommended by doctor. Next, doing weight-bearing exercise to strengthen the muscles and the bones. Stop smoking if you are heavy smokers, as it can increase the risk factors of osteoporosis. As for women, consider about the good and the bad parts of hormone therapy. So, osteoporosis is a pathological disease where this condition will lead to a serious morbidity and mortality effects in elderly. It also leads to fractures, which are painful and it takes a lot of time to heal. Instead of that, osteoporosis can lead to another complication to our body. We need to be aware of osteoporosis as we also have a high possibility to get it if we do not take any prevention steps right now. If you think you are at risk of getting osteoporosis or have been diagnosed with it, please refer to your doctor for any prevention or treatment plan which can help in improving your bone health and reduce the risk of complications.